This is my second lecture. I hope you guys are enjoying the conference. We are going to talk about nuclear features of papillary thyroid carcinoma, the revisited section. So we see a lot of thyroids, and often I sometimes get a little bit like, oh, another thyroid tumor. It's the most common thing that we see in consultation, and often it's regarding a follicular patterned lesion. And the question is usually, is there enough nuclear features to make the diagnosis of a follicular variant of papillary thyroid carcinoma? And then if it is, then we have to answer a number of other questions because we have our new category of whether or not it satisfies the designation of a NIFT-P, which is, and I'm going to actually use the journal article to remember the full name, non-invasive follicular thyroid neoplasm with papillary-like nuclear features. That is a long name. So from here on forth, I am just going to refer to that as a NIFT-P. And I am going to take you through on how we get to that point, if we ever do. So our objectives is to look at the morphologic spectrum of papillary thyroid carcinoma and get a sense of how it's challenging for the various variant classification. And then I'm going to use the NIFT-P literature as a sounding board to discuss the nuances that are related to thyroid pathology. And before we even delve into that, I got to be real honest with you guys. Just talking about thyroid pathology makes me super anxious because it's an area that is so fraught with variability from one person to another. And this is not just in variability with regards to nuclear features, but even simple things as what connotates a papillae, and then even greater topics of what do we really define as invasion or angioinvasion for that matter. And it's when you take all of this together, it can become very frustrating. I can tell you my journey through just looking at tons of thyroids, I've gone through an evolution of just the whole perspective of thyroid pathology and have had to readjust my thresholds throughout. When I started in residency, I think my approach was pretty basic, not that much dissimilar to what we're even taught in medical school as it applies to the nuclear features. And then once I started my fellowship training, which I did at the University of Pittsburgh, and Dr. Raja Sitala was my fellowship director, and it was pretty funny because when I started the fellowship, he would call a lot of things follicular variants of papillary, and I would not even recognize them. And then eventually I started really picking up, and I swung in the other direction where I was calling everything papillary thyroid carcinoma, and I had to titer back to really hone in on what the nuclear features are and where my threshold was going to be. And then I moved to Cleveland Clinic to start practicing,